Motion on Women's Health Strategy. I can now ask the Clerk to read the motion.
That this Assembly calls on the Minister of Health, working with his executive colleagues, to bring forward as a priority a fully budgeted women's health strategy that supports women through every stage of their lives and is focused on education and awareness raising, screening and earlier diagnosis and support services and care pathways. And further calls on the Minister and his executive colleagues to include in this strategy a menopause clinic, earlier gynaecological cancer screening, a framework of support relating to fertility, birth control, pregnancy, baby loss and postnatal health care, an emphasis on menstrual health, including long-term specialist support for endometriosis, and plans to tackle health inequalities experienced by women from different socio-economic and ethnic backgrounds.
Thank you. Call on Nuala McAllister to move the motion. It's moved. Thank you. The Business Committee has agreed to allow up to 1 hour 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose and 10 minutes to wind. As an amendment has been selected and is published on the marshalled list, the Business Committee has agreed that an extra 15 minutes will be added to the total time for the debate. Please open the debate for the motion.
Thank you, Deputy Speaker. I rise to propose this motion this morning, calling for the creation of a fully budgeted women's health strategy, addressing every aspect of a woman's life from birth as a priority. There have been many women's organisations, medical organisations and lobby groups that have been in touch over the past week, but also who have been in touch over the past decade to lobby and ensure that we highlight this issue and that we can get support across this chamber for a women's health strategy. There are many issues, Deputy Speaker, that we can talk about today, and each one of those organisations have highlighted it to me and I'm sure other MLAs in the chamber. One such group that I want to pay tribute to are in the chamber here today, I think maybe perhaps behind me there. Nothing About Us Without Us, who have been working on this issue for a number of years to ensure that their voices as women are heard when it comes to the commissioning of such a strategy. Moving on to the motion itself, it is an unfortunate reality that women often face additional barriers to accessing proper health care. Health concerns presented by women are still too frequently dismissed or incorrectly attributed to mental health or menstruation or the monthly cycle. Women are more likely to receive incorrect diagnosis for conditions such as strokes or heart attacks, which leads to a delay in treatment and worse outcomes. Evidence has shown that a lack of research into conditions specifically affecting women can lead to poor health advice, misdiagnosis, delayed or ineffective treatment, and overall worse outcomes. Conditions like endometriosis often go undiagnosed for years, further exacerbating women's health disparities. Therefore, if we are to tackle the health inequalities facing women, we must take a holistic approach, encompassing all aspects of healthcare. It must begin with ensuring there is proper health education for women. From puberty to pregnancy, menopause to mental health, we must ensure that everyone is equipped, not just women, with the facts around the health challenges that specifically impact women throughout our lives. Proper screening and early diagnosis is crucial to ensuring improved health outcomes. These include the need for improved screening for gynaecological cancers. The current delay in smear test results, sometimes up to 6 months, is undoubtedly causing anxiety and could have a devastating impact on a patient's prognosis. We are talking about a cancer that could be eliminated within the lifetime of today's young girls. And I'm sure that everyone in this chamber would agree that we all felt the angst around the current issues with the Trust's review of cervical cancer, some probing as far back as 2008. Any strategy must include lessons learned from these reviews and how we can mitigate against late diagnosis in a cancer that we can eliminate. Deputy Speaker, it is Sexual Health Week, and through proper factual health and sexual health education, young girls can equip themselves with the proper information about their bodies, their health, and how their life can impact upon their health. And of course, contraception is a vital element here, and it is imperative that any women's health strategy includes raising awareness of the various forms of contraception and the effects that it has on our bodies. Too often, young girls are pointed to specific contraception without knowledge of what is on offer and what may be best suited to our bodies. Fertility treatment, pregnancy health and postpartum health are also key components of a women's health strategy. I've recently been engaging with the Royal College of Midwives, an organisation providing vital representation for midwives and advocacy around maternity issues for years. They highlight the impact of the health of a woman on maternity services. The healthier women are at the start of their pregnancies, the better the chances are of a more straightforward pregnancy and birth. Pregnancy is an opportunity for women to avail of health service that may impact and improve their health overall. It is a period of several months when women will be in contact with healthcare professionals. They are usually younger women and therefore at a time in their life when they can change unhealthy habits before those habits have taken an irreversible toll on their bodies. And very importantly, maternity care is a moment to spot mental health issues and get them treated. And the importance of perinatal mental health cannot be overstated. But in a woman's health strategy, these maternity services, including mental health, should be part and parcel of a holistic approach. The motion also discusses the importance of inclusion of menopause services. We need to see specialist menopause clinics and a distinct menopause strategy within the action plan. For too often, education and awareness around this has been lacking, with women left unprepared for the realities of menopause. I was glad to see that so many of our male MLAs took the opportunity to wear the Meno vest last week with Over the Bloody Moon and get a taste of what women experiencing menopause will go through. Deputy Speaker, I think that is very important, and any other MLAs who would like to avail of the service, I do think that they should, to get a taste of what it is like for our older members. I want to thank the Chartered Institute of Physiotherapy for highlighting the crucial role that physiotherapy can play in addressing many of the health inequalities that women face by providing tailored care for women throughout their lifespan. From prenatal care to postpartum rehabilitation, pelvic health, menstrual health, menopausal health, breast health and preventative care, physiotherapy can offer comprehensive support for women's unique health needs. This is just one example of how this strategy can and must take a holistic approach. It is also important to note that any strategy must take account of the additional issues with which women from different socio-economic and ethnic backgrounds face. There are clear disparities in health outcomes and life expectancy between the most and least economically prosperous areas of Northern Ireland. Research has also clearly shown that women from ethnic minorities face additional barriers when accessing healthcare, with particular challenges presenting with maternity care. If we are to properly address this, it must be an intersectional approach. I welcome the amendments submitted by Linda Dillon and Liz Kimmins asking for a reduction of the gender gap in cardiovascular outcomes to be included, and we will support today. Heart disease is the leading cause of death for women in Northern Ireland, with around 26,000 women here living with heart disease according to the British Heart Foundation. There is a clear need for a gendered approach to tackling the prevalence of heart disease and the disadvantage that women face at every stage of the patient pathway. I was glad to see that the Minister referenced the need for a Women's Health Action Plan in his remarks when returning to office last week. This is a piece of work that is long overdue, with work beginning in the department but unfortunately being delayed to the pandemic and the collapse of the Assembly, and it is important that any such action plan takes on board a co-design approach with the many organisations and practitioners who are experts in this field, Minister. It is crucial that work resumes as soon as possible on this strategy to ensure that women in Northern Ireland can have confidence that their health is a priority for this new executive. Thank you.
To move the amendment. Thank you, Linda. Thank you. Linda, you have 10 minutes to propose and 5 minutes to wind. All our speakers will have 5 minutes. Please open the debate on the amendment.
Thank you very much, Mr. Speaker, and I want to thank the members for bringing this motion to the Assembly today, and I welcome the opportunity to speak to the issue. That we're having to call for a women's health strategy in 2024 is far from ideal, but I am glad that we are finally getting to that point, not only to having the conversation, but to hopefully having the opportunity to actually implement a strategy. And I know that the department have already been doing work, even in the absence of an assembly, and was given that reassurance by the Permanent Secretary in the meetings that I did with him prior to this assembly being restored. I would like at this opportunity to thank our MLA, Orlea Flynn, as chairperson of the All-Party Group on Women's Health. She has kept a strong focus on the issues facing women and their health. Orlea has hosted a number of excellent events and speakers to give us the detailed information and the uncomfortable truths about the gaps in services for women in many areas of our health. We have heard from health professionals and from women with lived experience, and the amazing charities that are supporting women, including Menopause Support NI, endometriosis support groups and the Heart Warriors group, who will be here next week for all MLAs to drop in and get a chat. I want to thank our male colleagues from across the chamber who supported the recent event in the Long Gallery, and for donning the menavest to again highlight just some of the symptoms, and I need to stress, just some of the symptoms of the menopause. This support is very welcome, as inequalities in women's healthcare impacts all of us. There is a cost to the women, there is a cost to her family, to society and to our entire economy as a whole. And it is everyone's responsibility to tackle these inequalities. And I am aware when we talk about women's health, people think we are talking about gynae health. But if we want to truly make a difference to the health outcomes and quality of life for women, we need to ensure that all areas of health where inequality exists are included. And it is for this reason that we are proposing the amendment to the motion today. And I am glad to hear that the proposer of the motion will be supporting our amendment, and I hope that all MLAs across the chamber will support it. A reduction in the gender gap in cardiovascular outcomes must be included in any women's health strategy. There are significant gaps in awareness, diagnosis and treatment of heart disease for women. Heart disease is in fact the leading cause of death for women in the North. Approximately 26,000 women here are living with heart disease, and it kills twice as many women as breast cancer. In 2022, almost 2,000 women died from heart and circulatory diseases in the North, with 334 of those deaths resulting from heart attack. A heart attack is a medical emergency, and as we all know, timely, effective treatment is critical. However, the British Heart Foundation funded researchers found that women are less likely to receive guideline-indicated care, and that more women die than men following a heart attack. Women are 50% more likely than men to be misdiagnosed or receive a delayed diagnosis following a heart attack, and are more likely than men to exhibit longer delays in seeking medical care after the development of symptoms suggestive of a heart attack. And I would say that we can attribute this probably to social bias, but also to the lack of awareness, the lack of education, the lack of understanding among both men and women, and among our medical profession, because most of the research around this issue was done on men. So we need to make sure that that changes. Women are dying needlessly of heart disease because our health system has failed to recognise and address the lack of awareness, the misdiagnosis, the delays in getting appropriate treatment. We have an opportunity in this new Assembly, and our new Health Minister has an opportunity to turn this around, to do better, to deliver for women who are being failed by our health system. I would also like to address some of the other areas in the main motion around the health care of women and the serious challenges in accessing services and treatment. As a 47-year-old post-menopausal woman, not afraid to say my age because I still think I'm younger, I have experienced firsthand the gaps in services and treatment, and just basic information and advice about how the menopause can affect you. I was only 40 when my menopause began, and I decided I would tough it out, that I would get through the hot flushes and get to the other end of it, and I could do it without HRT. But that was due to ignorance about what I was going through. It was due to a lack of understanding, a lack of basic advice around it. And I sat at an event in St Joseph's High School in Coal Island last year, and listened to Dr. Declan Quinn, and that presentation gave me more information in half an hour than I had had in my whole 47 years of life. So I think that tells us all we need to know about the information and advice out there for women. So for me, the big concern were the things, I knew I'd been through the hot flushes, I knew I'd been through 3 or 4 years of not being able to sleep. What I didn't know is that the brain fog that I was experiencing was due to menopause. What I didn't know was that it was impacting my bones. So the first thing I did the next morning was contact my GP and started HRT. And I'm very glad that I did that, because I am somebody who, as I said, feels young. I want to be as young as I can for as long as I can, as mobile and independent as I can for as long as I can. And we have a responsibility to ensure. Absolutely.
Agree with me that we need to remove the stigma of HRT. If you have any other condition, you will go and get the medication, but there is this reluctance for women to go forward and get their patches.
Absolutely, and it's one of the reasons why I decided to speak about my own experience here today, because I think if we don't talk about it, it's like anything else. It's not going to be, we won't be educating our women coming behind us, our daughters, or our own young women that are coming behind us. So I think it is important that we speak about it, that we normalise the conversation around it. And I have to say, I've talked about women and the support that women give women, but also men around us have given us great support. And I think that it's not that men don't want to be supportive, they just didn't know how to be. So that's why we need to talk about it. We need to have more education. And on that note, I do think that education around menopause needs to be included in our curriculum. My daughter is taught in school about periods and pregnancy, but not about menopause. And to be honest, I think, as the previous member has already outlined, the education in relation to menstruation is quite frankly inadequate, and in many cases too late. We need to see more age-appropriate education around women's health. We are almost entirely reliant on other women and the fantastic work being carried out by charities like Menopause Support NI to offer advice and support around the menopause. But unfortunately, our health service is sadly lacking, and likewise diagnosis and treatment for women and girls who suffer with endometriosis. Again, a lack of awareness, delayed diagnosis and lack of access to appropriate treatment means that women are suffering needlessly. This is an extremely painful and debilitating disease that can result in limited mobility, regular episodes of violent vomiting and extreme life-altering pain. And just yesterday I spoke with a strong, intelligent, motivated woman from my own constituency. And Anne, who had to be medically retired as a result of endometriosis, was openly offering to help and support others who have been diagnosed or are awaiting diagnosis, and to speak to MLAs about her experience to help them understand how this terrible disease can impact women and girls. And it is her determination to do what she can to ensure that services are improved. But Anne shouldn't have to fight. That's what we're here to do. That's what we're elected to do. And it is why it is so important that the Health Minister gives leadership on this issue and works with health professionals, community and voluntary sectors, charities, support groups and women with lived experience to develop an action plan that is properly resourced to ensure it can be implemented fully to create the real change that is required. We do not need to reinvent the wheel. An abundance of work has been done by many different sectors, and the answers are out there. We just need a formulated plan that is properly resourced, and we can look at the other plans that have already been developed across these islands. I have spoken with many health professionals who share our concerns about the inequality in women's healthcare and want to play their part in shaping better treatment and health outcomes for women and girls. As I said at the outset, we have waited much too long to see this, but I believe that we have a Health Minister in place who wants to work with us, and we certainly want to work with him. And we will, as committee members, hold him to account on a women's health strategy. I hope that we will see it coming forward in the very near future. And I think that it's very appropriate that we have the group here today who are named Nothing About Us Without Us, because I don't think it's any coincidence that because there are more women on the floor of this chamber, that these issues are coming to light, because the right decisions will not be made for women unless women are in the rooms where the decisions are being taken. Gormila Mayogov.
Thank you, Mr. Speaker, and for my congratulations on your post.
And to you, Minister, thank you for coming to respond to this debate. We do, as a new member of the Health Committee, I look forward to working with you, holding you to account, but I hope working constructively in the things that we do, because it is very important. I rise today to offer my support for the motion and indeed for the amendment. I think that these are extremely important issues, and it has been said by the previous speaker, they offer at times an uncomfortable truth into the state of services for women's health in Northern Ireland. So on a broad level, I want to welcome this motion as appropriate and indeed necessary. Just a few remarks at the very outset, because before I want to address a very specific issue in relation to women's health, and that is the idea that in this House we're very fond of talking about strategies. And yesterday we talked about a strategy, and no doubt next week we'll talk about another strategy. But actually what we need is action. And strategies take years to develop, they take money to implement, but that is no reason not to have action in the meantime. And Minister, if you hear nothing else, I hope you hear that today loud and clear. I also want to acknowledge, and I think it's really important, that we look at the link between deprivation, poverty and poor health, particularly for women and indeed for families. And I think that this is something that we need to have a strategy that just doesn't copy other strategies, but that actually is pretty much joined up and quite specific and very, very important. But today, for the remainder of my time here, I want to focus on an issue that has impacted 17,000 women in the Southern Trust area of Northern Ireland, and that is the issue of the review of cervical smears. These smears are from a period from the 1st of January 2008 to October 2021. It impacts 17,000 women. 17,000 people have letters telling them that they are part of this review and that they may or may not need further action. This has caused huge amounts of worry and poses really important questions for how we deal with these health issues for women. And before I get any further into the issues, can I just say there is some amazing work being done by the Trust in relation to this. They have actually gone out of their way to try to help, but there's also fantastic work being done within the community and support being given within that community. Now, last week, the Trust came up and answered some questions on this matter to the All-Party Group on Cancer, and that was very, very helpful. But this is a matter that has been known about for some considerable time. And if I've written down the figures correctly from the information that was given at the group last week, to date, only 1,740 slides have been reviewed. Only 1,084 letters have been issued. There has been incredibly slow progress on this matter, and it is a matter, for some people it will be a matter of life and death, and it is massively, massively important. So I am asking the Minister today that he makes sure and takes charge of this issue to make sure that there is the capacity within the Trust and indeed other trusts to help out in speeding up the process of this. So just in closing, and I don't want to go over my time too much with your indulgence, Mr. Speaker, just some things that these women have asked me very, very specifically to mention in relation to their tests. Many of these women will want to see the review procedure conducted fully, and that is not just their HPV status, but also the cytology behind their tests. Many of them want to know, Minister, what is the process? Oh, of course I will, yes.
And of course, because in regards to this issue, I do want to address her and give her that little bit extra time. in regards to your speech, because I can say that plans have been developed by the Trust and PHA actually to address the cervical screening review of those samples, and assurances on this and the wider cervical screening programme are being provided to the Department via cervical screening oversight and assurance group, which has been now chaired by the Deputy Chief Medical Officer, Professor Lurda Hagan, and Peter Toogood, our Deputy Secretary of Social Care. So just to give the member a little bit more time in regards to this topic.
Thank you, Minister. And I do appreciate that this is something that the Trust and indeed the Department have and should take very, very seriously. But there are a number of issues that are still outstanding. We have a remarkably low uptake of appointments in relation to the cervical screening.
The member bring her remarks to a close,
yes,
please. Thank you.
And we need to address that particular issue. We also need to address the issue of assurance for screeners in the future. The national performance level for this is 90%. The Southern Trust actually adopted lower performance
I could
levels.
ask the member to bring her remarks to a close.
But we do, Minister, need to make sure, and we need to hear from your department, that you will ensure that this performance level is reviewed and kept at an appropriate level.
Thank you. And I call on Alan Chambers.
Thank you, Mr Deputy Speaker, and can I take this opportunity to congratulate you on your appointment to your new role in this chamber. I wish to commend the proposers of the motion for bringing this very important topic to the chamber today. A fact that I often find staggering is that although women in the UK on average live longer than their male counterparts, women spend a far greater proportion of their lives in ill health and disability. And that's not just a quirk or a coincidence. There are big and important reasons behind it. For far too long, women-specific health issues were often either ignored or openly disregarded. Certainly, it seems that until only fairly recent times, the whole issue of women's health received much less public attention and discussion than it deserved. With such advances in science and understanding, as well as in modern medicine and treatments, there shouldn't be any taboos subjects in 2024. As has been said, women make up 51% of the population, and yet, as a man, I freely accept that there remains a misunderstanding, or perhaps better described as a lack of understanding of some really important issues. That includes not only the menopause and of menopause symptoms, but a slate of other issues also. I'd be the first to acknowledge that more awareness is needed by myself and many of my male peers to highlight just how severely the issues can impact a woman's life. There have been so many changes over the last 50-odd years, and thankfully the contribution made by women to society and to the economy is now better recognised and celebrated, especially compared to how it was so overlooked in years gone past. But of course, there's much more that could be done. And they're not just perceived barriers to better women's health, but real and actual obstacles. The reason Getting It Right First Time report was really important in highlighting the measures necessary to improve access to gynaecology services. And similarly, whilst there has been some really important progress made in recent times on broadening fertility support, as well as critical investment in the likes of perinatal mental health, I think we can all agree there is still more to be done. With so many problems already weighing down on our health service, we can scarce afford to be making the situation any worse. And yet, that is exactly what is happening with such profound health and social inequalities. And these inequalities are sometimes directly contributing to high unplanned pregnancy rates, the clear gender gap in cardiovascular outcomes, poor maternal outcomes, and high obesity rates, to name just a few. So I think the case for a women's health strategy is well made. And so, listening to the media last week, I was reassured by the commitment of the current Health Minister to move at pace in this regard. The development of an action plan will immediately focus minds and should deliver progress now in the areas where possible, while the development of a much higher level and more strategic women's health strategy runs in parallel. I suspect there will be broad political unanimity from the Chamber for this motion, and that's something we should all welcome. And in particular, I suspect there's also unanimity in the need to adopt a whole life course approach, a phrase that I suspect we will start to hear more often in this Chamber. Our health service belongs to us all, and so goes without saying that it must also serve us all. And in particularly, that must see the fundamental principle of equal access to treatment prioritised on the basis of clinical need and not of either personal circumstances or gender. Therefore, Mr. Deputy Speaker, I and my party fully support the motion and the amendment before the House today, and I look forward to seeing work on both the action plan and strategy getting underway very soon. Thank you, Mr. Deputy Speaker.
Speaker, and congratulations on your position as Deputy Speaker. The SDLP will be supporting the motion today, and we will also be supporting the amendment. Last year, a woman came into my office who was waiting for surgery for endometriosis. The debilitating pain had forced her to leave a job that she loved in the health service. Years later, she was languishing still on a waiting list, weighing up whether to remortgage her family home to pay for private treatment. And she is not alone. This is just one of the countless stories from women who face barrier after barrier in accessing healthcare. Last year, I carried out a survey on women's experiences, and I had over 500 responses, and it painted a really stark picture of a broken and inaccessible service. I have delivered the full report to the Department of Health, and hopefully the Minister will know that 90% of respondents felt that there was an inadequate service provision available for the biggest healthcare issues affecting women. They listed gynae health, mental health, maternal health and menopause as support and many other issues, and I'm deeply grateful to them for their personal stories. They were stories of pain that had been dismissed, conditions that had been misdiagnosed, and a taboo that had set in when discussing menopause, sex education or periods. There were just some of the almost 10,000 women across the North waiting more than a year for their first appointment with a gynae consultant. This research adds to the mountain of evidence of how differences in how women are assessed, diagnosed and treated added up to huge inequalities. For example, the research which shows endometriosis affects 1.5 million women in the UK, a similar number of women affected by diabetes. But while diabetes services are well established, there is a devastating lack of support for women with endometriosis. It is long past time. Oh yes, certainly, sir.
For giving way, and would you agree with me that the length of time it takes to get diagnosed with either endometriosis or PCOS, for example, is absolutely shocking, and that early intervention and that early diagnosis is key to treatment and to quality of life? And would she also agree that it's key that we ensure our GPs have appropriate training to highlight and diagnose these issues? Thank you.
Thank you, Member, for the intervention. Absolutely. It can take anything from 10 to 15 years to be diagnosed with endometriosis.
The member has an extra minute.
I first suffered my first symptoms of endometriosis when I was about 16. I was 26 before I got actually diagnosed, and that was a way back in different decades in the 1990s. And unfortunately, our diagnosis has not moved on in that time. In fact, some of the gaps are getting larger. So it's long past time for the inequalities faced by women accessing healthcare by following the example of every other part of these islands and agreeing a comprehensive and fully funded women's health strategy. While an action plan is currently underway, and that is to be commended, there is no substitute for a strategy with meaningful timelines and funding attached, one that can address the inequalities women face in their lives lives, from puberty right through to post-menopause. I've engaged extensively with grassroots women's organisations across the North West, organisations like Dairy Well Women and Dairy Women's Centre and many more, and they have been forced to plug the gap of statutory services, delivering programmes on the ground for women in desperate need. Mr Speaker, now is not the time to start small. Women deserve ambition. That is why a women's health strategy must end the postcode lottery for services through regional bands. This means rolling out regional women's health hubs where women from across the north can secure faster access to treatment. And this includes abortion services. The Health Minister must fulfil his obligations in providing these services. Abortion is healthcare. A women's health strategy should also introduce better training for healthcare professionals, funded research on the gender inequalities in healthcare, and the collection of the right data to inform that policy. Our healthcare workers are dedicated, but they need to be supported by the right tools. The development of a women's healthcare strategy must incorporate the voices of all women, particularly those who are Black and minority ethnic, disabled and LGBT. Only by being fully inclusive can the strategy be fully effective. I firmly believe that this work should be led at a senior level. England has appointed a Women's Health Ambassador. We should follow their lead so one person can lead the implementation of this strategy. Mr Deputy Speaker, an ambitious, intersectional, regionally balanced women's health strategy has the power to radically improve women's lives and their outcomes. But women are literally sick and tired of waiting. Thank you.
May I call Orla Flynn?
Goramiaga, thanks very much, Alas Cancolia, and also welcome you to your new position as Deputy Speaker. So I'm very happy to rise today and speak in support of the Alliance motion and also the amendment that's been led at the Assembly. I do want to mention by just by just mentioning some of the work of the Women's Health All-Party Group, which we established 3 years ago for MLAs, organisations and individuals to have a chance to come together and to discuss our shared interest on this very issue, on the issue of women's health. And I want to give a special mention to Pam Cameron, who had originally took on the position as Vice Chair from the DUP. Paula Bradshaw has been brilliant. She's the current Vice Chair in place at the moment. And then Sinead McLaughlin, Linda Dillon, Robbie Butler, who also comes to the meetings frequently. I'm sorry if I've left anybody out, but I think it's just been great that up until this point, I think we already have seen a genuine cross-party consensus on the issue of women's health. I think we've seen that through the all-party group structure. So I hope that there's obviously full support for the motion when we've finished debating on it today. So again, just to give people a sense, I know some of this is going to be sort of repeating what others have already mentioned, but since the establishment of the all-party group, we have covered numerous really important topics, and each of them, and this is the problem, each topic that we have covered has just been as important as the other. And I think that this is going to be the challenge in putting in place a proper and a robust women's health strategy, because I think that what we need to ensure, and what's going to be difficult, is that we need to be inclusive and aware of all of the issues that impact on a woman's health throughout our lifespan. And obviously we're talking about a lot of different important topics. Some of the ones again that we've covered just to date in the APG structure include human rights and pregnancy, childbirth, maternity services, perinatal mental health services, miscarriage, fertility, baby loss, MESH, menopause and breastfeeding, mental health, pelvic health and abortion. And then again, there's an even longer list of the issues that we have yet to cover. And some of those are including the gynae services, the endometriosis, which has already been spoke about, addiction, cervical cancer, breast cancer, and then the more specific issues in terms of gender gaps that Linda had touched on in terms of the amendment, which include bone health, heart health, autism, self-harm and eating disorders. So, and I've no doubt that there's probably a lot of things that I'm missing out from my own notes there, but it just shows you actually how much massive, massive issues we're talking about here, and how much that we need to grapple with in terms of what is a strategy going to look like, and practically take obviously what the Diane Dodds, the member, had says earlier as well. We also need to, I think, try and get things delivered and actually try and get things done in the interim, because this is going to be a vast, vast piece of work. So again, as I was saying, that list just does give you a sense of how much we need to do in order to try and achieve gender equality within our health system. And again, we know that the health system was a system that was designed by men, and sadly at different points in times in history we have seen repeatedly that it has let women down. In terms of different scandals, in terms of lack of investment for the issues that we've been talking about. And I know that Alan Chambers had mentioned as well, in terms of even just that lack of knowledge and understanding around some of the issues that a woman will go through throughout her life, but that a man won't. Again, we know that women are living longer than men, but yes, of course.
And I just want to pay tribute to Orlia and indeed Paula and other colleagues who have done work on the issue of vaginal mesh. That's something that the member and I have been involved in at various points in time over the years. And would the member agree with me that the plight of women who have been impacted by vaginal mesh is totally unacceptable? And indeed the news coming last week from GB off the back of the Independent Medicines and Medical Devices Safety Review is further proof of that, and indeed that women in Northern Ireland cannot be left behind whenever it comes to the issue of vaginal mesh.
And the member has an extra minute. Thank you.
And yes, completely agree, and I spoke on that this morning around that issue of the Hughes report, so genuinely hope again that we can get some cross-party consensus to try and get some of that work over the line for our local women that were injured by mesh. But I suppose then, without the overall strategy, what we're lacking here as well is the joined-up approach across our trusts. And again, we know that we're lacking behind other parts across these islands who already have strategies and action plans in place. So we need the urgency around that. And then just to come back to Sorha, you had mentioned, the member had mentioned the scandal of the mesh implant. But I was going to come on to that next and actually just explain that, as we know, women are making up half the population, they make up half of our workforce, but yet sadly we also know that they have been failed miserably over many, many decades with multiple scandals that have came to light, and they've caused much harm and hurt to these women. And you have the mesh, you have thalidomide, you have the mother and baby scandals, you have the cervical smear, which we spoke about. And that's only naming a few, but I mean, these are having massive, massive impacts on the health and the mental health of our women.
Could the member draw remarks to a close, please?
Yes, of course. So maybe just to try and finish off with a point around the maternity services, because I can't finish my speech without thinking about that. We need the women's health strategy, but also, when Mary ran through has concluded her reports, we also need a renewed maternity strategy. And I know that there was some shout-outs to some of the guests upstairs. I do want to also mention the Community Foundation Northern Ireland and the grassroots women that they have with them today. Looking forward to working with you. Sorry.
Thank you. I enjoyed that latitude. Okay. Got a call on Deborah Erskine, please.
You, Mr Deputy Speaker, and hopefully I get some latitude as well. I want to congratulate you on your new role, and also the Minister as well. I'm not sure if he's glad or sad I'm off the Health Committee. I'll let him decide that. I want to thank the proposer of the motion for shining a spotlight on this very important issue. It is undeniable that women and girls have lifelong health needs and risks which are not the same for men. And this includes obviously managing periods, menopause symptoms, and being uniquely predisposed to chronic conditions such as heart disease, particular forms of cancer and diabetes. Hence why I was glad that the amendment specifically mentioned the gender gap in cardiovascular outcomes. We must not forget the extra financial cost to women of managing periods and menopause symptoms. And it must be pointed out that without adequate health support, women can often find themselves needing extra time off work, and in severe cases actually having to leave the workforce altogether. Simple intervention and support within our medical professions and workforces could actually prevent this from happening. So therefore, the duty is not just on the health department, it's a cross-departmental issue, and I'm glad that the motion does point to that cross-departmental element. There is a need for women and girls in Northern Ireland to have better, more accurate and timely information to support the need to face the challenges that they will face. It simply is unacceptable that women face crippling anxiety, sleepless nights, because they are forced to do their own research and figure out how to access the right support. Now, we know that there's health strategy in place in England and a women's health plan for Scotland, and it's my understanding that ministers are in the process of producing a similar document in Wales. Northern Ireland should not be left behind in identifying and tackling the issues head-on. Furthermore, it's important that any women's health strategy does not fall victim to the pitfalls elsewhere. We need to take account of our own unique position in Northern Ireland in terms of our health trusts, our education system, the council and the role they can play, and indeed our community and voluntary sector, who play a vital role in our communities, particularly deprived communities. It is crucial that we do not raise expectations either, only to have an eventual strategy fall flat. There need to be clear metric indicators for measuring success, as well as strong levels of accountability built in. And this is even more important if the strategy is in a lifetime of 3, 5 or 10 years, to make sure it actually does what it says on the tin. We must ensure that any strategy coming forward also complements any forthcoming anti-poverty strategy, the violence against women and girls, and any other health strategy, so that there isn't any divergence, I suppose, in policy. Ultimately, a women's health strategy in Northern Ireland will only succeed if there's wholesale buy-in from our communities, from healthcare professionals and from women themselves. The stigma that sometimes is associated with menopause and endometriosis must be addressed. Even within primary care, we need to ensure GPs and other frontline health staff are trained and have a better understanding of the toll these conditions from an earlier age, so that the right care and treatment can be provided to those women and girls affected. Yeah.
I thank the member for giving way, and I just wanted to ask if the member would agree that education of young girls being critical in this very important topic, would it be her opinion that this should be led by a Department of Health or through the schools or the voluntary community sector?
And the member has another minute.
And I thank the member for her intervention. I believe that this is cross-departmental, and certainly the earlier that we can get education for young girls, the easier it will be to go forward in some of this. Most women just want to be heard and listened to, and many of us who've went to the doctor have that fear of our concerns and symptoms being recognised and heard and action being taken. So I hope today is the start of ensuring women and girls across Northern Ireland have the right access at the right time, with the right education in place, so that we can build healthy communities going forward. Therefore, I support the motion and the amendment today, and I look forward to seeing progress in this regard. Thank you.
Thank you. And I'll try it again. I call on Kelly Armstrong.
Very much, Deputy Speaker, and congratulations on your role in the chair. Today we're talking about a motion, and the motion's about the women's health strategy. And Minister, I know a motion is a motion and it's not something that you have to act on. However, I do hope that you listen, and I know you've said before about a women's health strategy is within your thinking, and I certainly welcome that, because since 2021 we know that Scotland has already had their women's health plan. Since summer 22 England has had their women's health strategy, and since November 22 Wales has had their foundations for a women's health plan. So I hope that we can certainly take that forward. What I would say is any strategy needs to run in time for budgets. And that could be the constraint that we will have on this. And as others have mentioned, it's very important that we have a fully funded women's health strategy. I think that here in Northern Ireland, women deserve the same level of commitment from this government as other parts of the UK women have there. My colleagues have outlined different key actions that should be included in a women's health strategy, but as an older woman in this place, there are matters that I have experience of that the Minister, I hope, will listen to me about and take seriously. And I'd like to thank the Minister for attending Orlea Flynn's menopause event when he wore the Menovest. I only wish that you had it on now to see exactly how warm it is in this chamber today, but it is something, one of the symptoms that some of us who've been through menopause have suffered.
Will the member give way?
Oh, certainly, thank you.
Thank you, Mr. Speaker. I was one of the MLAs, and I know there are a couple of other ones in the room who donned the Menovest at that event, which was very, very informative and very educational. Would the member agree with me that we need more education on the symptoms and actions that can help women, particularly women in employment, to stay within their jobs and stay within their careers who are suffering from menopause?
And the member has another minute.
Thank you very much, and I absolutely agree with the member. I'm going to talk actually about how many women of my age choose to leave work because of symptoms. Menopause, including surgical menopause, which many people forget to mention, is life-changing and impacts so many areas of a woman's life, including her physical and mental health. There's impact on her finances, there's a proven negative impact on her employment and her relationships. A funded women's health strategy must make provision for services that support menopausal women, and that needs to include mandatory training for GPs, given so many women have had to turn to private health just to access treatment. GPs should be instructed to prescribe medicines that have been recommended by private practice. The strategy should include research into the broader benefits of testosterone for women, and there must be resourced menopause clinics available in each trust area for every woman. But to be honest, I would prefer that there was actually a specialist in each GP practice to give access to all women. I know that the health system is financially broke, but women are being broken because our health service is not currently meeting their needs. Many older women, like myself, feel disrespected, ignored and demeaned by a health system that considers many of us to be an annoyance rather than key members of society. And I can still hear the eye rolls whenever I phone up to get my HRT prescription. The Women and Equalities Committee over in Westminster confirmed women felt that there was a lack of awareness or understanding of menopause, even amongst women. Believe me, some of the most disappointing comments I have heard about menopause have been from younger female health professionals and other women in the workplace. BUPA have confirmed as part of the Westminster inquiry almost 1 million women had left their jobs because of menopausal symptoms. Given the age when women have menopause is between the ages of 45 to 55, this is the time when many people reach the peak of their careers. Therefore, by not having a specific menopause strategy delivered through health, we are sidelining some of the most incredible and skilled people from our workforce at a time when Northern Ireland can least afford to have people not in work and to lose such skilled personnel. Therefore, I back a call to have a women's health strategy that will at long last provide a plan to invest in resources, including training for health professionals. Lastly, Mr. Speaker, I wish to address a matter very close to my heart, and that is miscarriage and fertility treatment. For many people in Northern Ireland, fertility is not simple or easy. I have never hidden the fact that I have been through miscarriages and IVF, and it was painful in so many ways. A key element of any women's health strategy has to be access to fertility specialists and support for women following loss, during and soon after pregnancy. Like menopause, fertility support is very limited through our health service. For many, health treatment is not free at the point of use. In Northern Ireland, we have a growing private fertility system where families are spending thousands of pounds to access treatment that is available elsewhere in the UK where NICE guidelines are being delivered. If we are to provide a fair and equitable health service that will deliver for women, then we have to consider why here in Northern Ireland it is acceptable for women to have to look to private health providers as their only option for treatment. Minister, I will hold you to your word. I hope to see a women's health strategy in this mandate. Thank you.
You're next on, Sean. As this is Sean Mulholland's first opportunity to speak as a private member, I will remind the House that it's the convention that a maiden speech is made without interruption. I call Sean Mulholland.
Thank you, Mr Deputy Speaker, and congratulations on your new role. I proudly rise today to support this motion on behalf of the many women in my constituency of North Antrim. But firstly, as this is my maiden speech, I'm in the unusual position of acknowledging not one but two predecessors, because it would be remiss of me not to acknowledge the almost 2 decades of representation that Mervyn Storey gave to my constituency, and I thank him for his service. Patricia O'Lynn was unable to avail of the opportunity to rise in this chamber on behalf of our constituents, but I thank her for the work that she carried out in the months following her historic election to this place as the first woman from North Antrim. Rest assured, I am honoured to represent North Antrim now, and I will do all within my power, with passion and heart, to represent those who voted for an alternative. They say it takes a village to raise a child, and that is never more true than the child of a politician. And I recognise the support of my family, especially my mother Harriet and my husband Kieran, who have taken over the primary caring responsibilities for our beautiful 7-week-old daughter and our 2 wonderful sons. I promised Alfie and Cahill that I will be home for bedtime stories tonight, so thank you for their patience. As the first mother to represent my constituency, I am passionate about the voices of women and parents being heard in this chamber, which brings me to this motion, which is so pertinent not only to my very recent experience, but also to the experiences of many felt within my predominantly rural community, which brings its own challenges to the access of healthcare before we even begin to address the inequalities which exist for women in the healthcare arena. The Maternal Mental Health Alliance, in their 2023 briefing, recognised that there has been an improvement in service provision across Northern Ireland in recent years. For example, all 5 health trusts now have a community perinatal mental health team in place, and that's a very, very welcome development. And can I pay tribute to those professionals and indeed the Minister for his work and their work in developing and rolling out these teams. But we still have a long, long way to go. The MMHA outlines a number of risk factors with regards specifically to perinatal mental health in Northern Ireland, including the variations between trusts, making service provision a postcode lottery. Everyone in Northern Ireland should have the opportunity to avail of the same level of service provision and access to perinatal mental health. We also need to see the development of workforce planning and funding to increase training opportunities to bolster our workforce. Without properly trained and fairly paid staff, there will be no one to deliver these precious services. A number of years ago, I was able to engage with the WRDA's Mothers Advocacy Programme, MAS. It was through this engagement that I shared my own experience of perinatal and postnatal mental ill health. During that most vulnerable time, my abiding memory is the absolute crippling fear that my baby would be taken from me, either as a result of me accessing the care and help that I so desperately needed, or because I would be deemed unfit for even experiencing the horrendous postnatal anxiety and depression I felt. This fear would have been somewhat alleviated had there been a specific mother and baby unit. The lack of executive has certainly hampered the implementation and delivery of this crucial service, which is definitely regrettable. The commitment and work done to prepare the business case is great, but we now need to see funding and commitment to delivery, and I would call on the Minister to outline a timeframe for delivery of this unit. Without delivery of a mother and baby unit, Northern Ireland risks falling further and further behind the quality and variety of specialist services offered in other jurisdictions. Northern Ireland is the only part of the UK without a specialist unit. In addition to the perinatal mental health delivery, we need a properly resourced women's strategy that delivers a comprehensive and multidisciplinary approach to the care pathway for new mothers. The antenatal care received by women can be wonderful and can be focused on the recovery and full support of women at a vulnerable time, but there is also the potential for women to fall through the cracks when signed off by a community midwife up to 2 weeks postpartum, with care then transferred back to the GP and sometimes back to the hospital of birth. For women, especially those with a traumatic or surgical birth, wraparound multidisciplinary level of care is absolutely essential to ensure that all mothers begin their journey into motherhood feeling valued, seen and cared for. I don't want Northern Ireland to be a place apart from the rest of these islands because it is falling behind. Rather, I want Northern Ireland to be set apart and to be known as the place where antenatal and postnatal health of women is prioritised and funded to the extent that our families enjoy world-beating services. So a women's health strategy must include these vital components. Thank you, Mr. Deputy Speaker.
Thank you very much indeed, and thank you very much indeed for your maiden speech. I call Colin McGrath.
Deputy Speaker, and I congratulate you on assuming your role. Our normal contact is through BIPA and pints, and if there's latitude, I just want to let you know I always paid my way, so to do that. And also to congratulate Shannon on her maiden speech. I welcome the opportunity to speak here today, as I think that it is timely to be discussing these matters. It's long been acknowledged that there exists a significant need for a women's health strategy. And we are, after all, the only region across these islands without such a strategy. And too much for too long, women's health has been the subject of taboo and stigma across our society. And when it's been talked about, it's often been talked about in whispers. And look, I'm not embarrassed to say this, I'm part of that generation that was brought up where you didn't really talk about these things. I remember very much in my early 20s making a phone call to the local hospital, and I didn't know how to get the words out, and eventually asked to be put through to the female gynae ward, at which point the operator said, "I'll hardly put you through to the male gynae ward." But that was just the way that things were back in that day, and I'm glad that we're getting that opportunity to be able to discuss matters and to reduce those taboos. And as a result of that, it could contribute to the fact that we have 50% with women that are more likely to receive the wrong diagnosis in terms of a heart attack. That it is women who have, that it is also women here that have the worst ovarian cancer survival rates, and that gynaecological waiting times here are much longer than anywhere else in the UK. Last year, my colleague Sinead McLaughlin conducted a survey on women's health with hundreds of responses, and 90% said that there was inadequate service provision for the biggest healthcare issues that were affecting women, and that is just not acceptable, that is what the perception is there. And when discussing essential healthcare matters such as menstrual health, the menopause or other issues as discussed in today's motions, we must listen to women, and I echo the remarks that were made by my colleague about the fact that there is a women's health ambassador in other parts, and that is something that we should and could replicate here. Mr Deputy Speaker, today's motion gives us the opportunity to set the tone for what the new Assembly term can be about. We are, after all, debating a motion that has been brought by the Alliance Party. It has an amendment from Sinn Féin, and it is calling on a health minister from the UUP to bring forward that strategy. So there is the potential for all parties to work together to deliver these things. But there has to be a question asked about why we don't have one now. Why is it that we have not had a strategy previously? But we're also without a violence against women and girls strategy, or an anti-poverty strategy, or the anti-conversion therapy strategy. There are many strategies that we don't have. And we know that it is because of the stop-go politics that we have in this place. And I would echo the remarks that have been made by the Leader of the Opposition, my colleague Matthew O'Toole, in asking the First and Deputy First Minister to commit that we will not collapse these institutions again, and give us the opportunity to be able to do the work that we need to do to deliver on those strategies. And also, in the time that we've been attending many conferences when this place hasn't been sitting, I have regularly made the comment that the biggest room in castle buildings must be the one in which they put all the strategies, because that's all that we seem to do. We launch a strategy, we get all the attention for that, but we don't actually deliver on it. And I think that we need to see a change in that. I want to be able to see action plans that sit alongside a strategy. I want to see costings alongside those action plans, along with timescales, so that we know that we will actually see delivery and see action on those strategies that are being put forward. Because too often we build up people's hopes by saying that there will be a strategy, but that lack of delivery simply lets them down. So we must see this Assembly term about rebuilding trust with the public and providing them with the hope that we will actually deliver on strategies. And this is a very important strategy that should be up there to be delivered quickly. Thank you.
Thank you. And I call on the Minister, and the Minister has 15 minutes.
Thank you very much, Deputy Speaker, and again, like others, can I congratulate you and welcome you to your post. And can I thank the members for bringing this important motion today. But can I also thank all the contributors for your openness, for your honesty, and for your personal contributions, because that's what is the strength of this place. When we debate things that affect all of the people of Northern Ireland. So I want to thank everyone for their contribution today and the tenure it's been had. And I want to start by saying that many of the issues, as we have said, discussed here today, are already priorities for my department, and I want to assure colleagues that work is actively ongoing to try to address these challenges, despite the very difficult financial position that the health and social care system faces. But progress on these key issues will be high on my list of priorities as a health minister, and that's why, as my party colleague had already said, but as minister, I'm keen to support both the motion and the amendment. And I can update the Assembly that my department is in the early stages of developing a Women's Health Action Plan for Northern Ireland. And this will, Mr Deputy Speaker, for the first time, bring all of that work together in a unified plan, actually to demonstrate that we are trying to achieve and highlight where greater attention and action will be needed. That will be the similar approach that I took when developing our mental health strategy, that we actually produced the Mental Health Action Plan first to allow that time frame to make sure the strategy was able to engage across trust, across political, across all stakeholders. And Mr Deputy Speaker, with your indulgence, I will pay tribute to the organisations who are in the public gallery, but I'll not name them all in case I miss someone. But I will say that I'll come back later to speak about the action plan, but first I want to pick up on some of the issues that have been discussed here and to outline the work that my department is doing in these areas. But as Leah Flynn has already pointed out, that each of these topics, I think, are worthy of a debate and a discussion in this place rather than just part of this general motion, and I'm sure the members of the Health Committee will take that forward, and I look forward to working with the new members of the Health Committee, and I pay tribute to those who I worked with in the past as well, because of that way that we were able to approach health in this place. As has been said, women and girls account for 51% of Northern Ireland's population, and yet not enough focus is placed on those women-specific issues. Each one of those nearly 1 million people, as we've heard today, has their own story. Each has their own experience of our healthcare system, and we hear daily, Mr Deputy Speaker, of their challenges and concern when it comes to getting access to the right care at the right time. And as has been raised by members, that includes getting that timely access to our GP appointments, specialised healthcare in rural areas, getting a timely diagnosis and advice and information on female-specific conditions or symptoms to help make those informed choices. And all of which can be compounded further by ethnicity and socio-economic background, and those additional barriers and inequalities faced by the most vulnerable groups of women and girls in our society. Mr Deputy Speaker, members are right to outline the key elements that need to be considered in a women's health strategy, actually to improve that provision and access to key services for menopause, services for gynaecological cancer screening, services for cardiovascular health, fertility and pregnancy, baby loss and post-natal health care, to name but a few. But we know in here, we know that collectively these issues cover the whole life course. So improving that lifelong health experiences and outcomes for women also mean better education and awareness from that early age. Learning about, as has been said, the importance of lifestyle and behavioural risk factors, the prevention of illness, living healthily, managing life changes like the menstrual health and menopause, living with health conditions, knowing how and where to seek help when needed. So for the health service, it's about making sure that that help is available and that help is accessible. I fully acknowledge the challenges across all these areas, many of which have already been highlighted by members here today. But Mr Deputy Speaker, I'm committed to addressing these issues for the women of Northern Ireland. And while there are probably too many to cover in the time available, there are a number of areas I do want to mention where I see opportunity for progress to be made. Firstly, I want to prioritise the implementation of the recent Getting It Right First Time, the GIRF report, to improve access to our gynaecological services. Our waiting times are simply unacceptable. The report that was published last month as part of the work my department is taking forward under the elective care framework, which I published in 2021, sets out recommendations to actually maximise our capacity, to reduce those waiting times, but to improve patient care and outcomes. And it's as Health Minister that I want to see those waiting lists come down to acceptable levels and expect to see that real progress made with these recommendations in the months ahead. My department has now written to all trusts about the report and will be engaging with relevant stakeholders to progress implementation as far as possible with available resources. And it's recognised that some of those recommendations will require additional investment, and this will impact delivery. And I want to join colleagues as well in recognising the impact that the menopause can have on women, who will all go through this change at some stage in their lives. Mr. Deputy Speaker, I wore the menovest for a short time, and I think Linda Dillon expressed it very well when she told me straight to my face, "Now you know what it feels like." Mr. Deputy Speaker, I only wore it for 45 minutes, and I want to ensure, and I would encourage those in this chamber who didn't avail of that opportunity, they should. We are seeing the start of a welcome shift, I believe, in those societal attitudes and actually understanding about the menopause. And I believe there's much more that a new executive can do to support this across, as has been said, all sectors. For too many women, as Ms Kelly said, are leaving our workforce early, and that includes in our health and social care system, where the majority of our staff are female. And we know that changes in policy could have a huge difference, both to those individuals, their families, and to the wider economy. So I want to stress that there are many examples of good practice in terms of menopause care within our system, and it is important to ensure that this is equitable and that best practice is standardised across the region. Mr. Deputy Speaker, it was mentioned in a contribution from Ms Dodds in regards to cervical cancer. We have a very effective screening programme which has saved many lives over the 3 decades, and I'm very pleased to see the full introduction of full primary HPV screening into the pathway in December last year. So thanks to the extensive planning by the Public Health Agency and trusts along with department officials. And that brings our system into the line with the rest of the UK by implementing the advice of the National Screening Committee and the Northern Ireland Screening Committee. And that will use a test which is more effective at detecting women at risk of developing cervical cancer. And this change will help in the prevention and early detection and ultimately save more lives. With regard to fertility, I recognise that there are many people who long for a child and are desperate to hear when the current fertility service can be expanded to offer a second and indeed a third cycle to eligible women. And that's in line with NICE guidance, but also a commitment from the New Decade New Approach Agreement. During the pandemic, one of my priorities as Minister was to reinstate and to stabilise fertility services as quickly as possible. And I'm pleased to say that the staff at our Regional Fertility Centre have worked extremely hard to bring waiting times down to a level which is better than before. And those times better than before the pandemic, with the first time appointment waiting 23 weeks, and new IVF and ICSI patients currently waiting approximately 2 months at present. So I'd like to thank the RFC staff for their hard work and dedication in doing so and preparing the ground for an increase in provision once capacity can be increased to enable this. Ms Mulholland, in her maiden speech, and I congratulate her in her maiden speech and look forward to working with her in Northampton, related to and mentioned our perinatal mental health. And in relation to our maternal mental health, each of our trusts now have an operational community perinatal mental health team in place, each accepting referrals and providing a consultancy service to women experiencing mental health problems during the perinatal period. And in addition, a regional implementation team has been established within the Public Health Agency. That team has been instrumental in leading the implementation of the community teams by actually having oversight and providing the guidance. And that as well actually ensures a regional consistency, creating referral pathways and ensuring that our new service is fully integrated and embedded into existing services. But also in line with my department's commitment to establish a mother and baby unit, as was actually set out in our mental health strategy delivery plan for 23-24. I can inform the members that the Belfast City Hospital site has been identified as the most suitable location, and the Belfast Trust has been invited to prepare an outline business case for the provision of the proposed regional unit. But delivery of that project remains subject to budget affordability, which, as members will know, has not yet been confirmed.
Thank you, Minister. I thank the Minister for giving way. I'm just conscious that he did mention, and we recognise the budgetary situation, but in not doing it and not progressing a mother and baby unit, it is actually increasing, particularly for the number of women who would need it, that budgetary pressures elsewhere. So in the initial spend, and yes, of course, we recognise it would be initial spend, it is saving in the long term, because those who go without the care that's desperately needed then impact on the health service elsewhere.
And I concur with the members' comments, as I can say about many services across health and social care. So I look forward to her encouraging her two ministerial colleagues to supporting my bids in regards to the forthcoming budgets, in regards to all the work that I want to do across health, as well as establishing the development and the construction of a mother and baby unit, as I actually set out in the mental health strategy delivery plan of 23-24. But Mr Deputy Speaker, I could go on, as there are so many other women's health initiatives across primary care, across social care, across pharmacy, across allied health services, including hugely important areas such as maternal health, sexual health and pregnancy loss that I don't have time to cover today. But I hope that I have assured members that significant work in this area is embedded in my department's work programme as a priority. I'm committed to providing greater focus and coordination on women-specific issues, and to prioritise limited resources where they would be most effective within my areas of responsibility as Health Minister. As I mentioned earlier, my department is in the process of developing a short, medium-term women's health action plan, which builds upon the ongoing work and identifies the priority across actions across women's health services, which can be taken forward within our current budget, as well as those where additional investment may be required. And that, Mr Deputy Speaker, will pave the way for a women's health strategy in the longer term. Crucially, as part of this work, I want to listen to Northern Ireland women and hear their views and experiences of the healthcare system and how it should be shaped going forward. I welcome the fact that as a society we are seeing much more public discourse about women's health issues, and I commend the groups, charities and councils who are helping to bring about that positive shift. I also acknowledge the need for improved public awareness and information. We are working with the Public Health Agency to understand how best we can reach specific groups of women and girls and what this might look like. I want to finish just in regards to this. I apologise. Indeed, we must take note that awareness raising should go beyond the female population to ensure that everyone has a better understanding of women's health issues and the wider impact that this can have, particularly employers. In conclusion, Mr Deputy Speaker, I want to assure members that we have a strong foundation of work in progress, which will be the key components of a women's health action plan. As this work is in early stages, I cannot say when it will be finalised, but I hope to say more about this in the weeks and months ahead. So by putting women at the centre of the discussions, we can assure that their voices are heard and that the limited funds are appropriately aligned with priorities. I'm confident that with the approach I have outlined today and the support of the Assembly colleagues, we can improve health outcomes for all women and girls in Northern Ireland. And I very much welcome today's debate and thank members for their contribution. And if Ms Dillon wants in briefly, I'll give way, Mr Deputy Speaker.
Sorry, there's no time for an intervention. Excuse me. Can I call on Liz Kimmins to wind for the amendment, please? And you have 5 minutes. Thank you.
Concordia, and congratulations on your new role. I welcome the opportunity to speak on this very important motion to improve healthcare for women and to address the health inequalities that many women face. And I'm very pleased to hear the Minister's commitment to delivering on this for women's healthcare. We've heard today, as others have said, on the broad range of issues that impact women, including how some conditions, which affect both women and men, but have a much more detrimental impact on women. And we must ensure that these do not fall between the cracks any longer. It's abundantly clear that significant gaps exist in women's healthcare, but these gaps are even far greater for those women who are living in high deprivation. And tackling disadvantage in the context of women's healthcare as a result of deprivation must form part of any forthcoming strategy. Over the last 3 years, we have seen other parts of these islands bring forward women's health plans. A women's health strategy for England was introduced in the summer of 2022. In the South, the Irish Government has introduced a women's health action plan. The Scottish Government introduced a women's health plan in August 2021, and NHS Wales published Women's Health in Wales in November 2022. Unfortunately, we have fallen behind the other jurisdictions at a time when we are aware that although women on average live longer than men, women spend a significantly greater proportion of their lives in ill health when compared with men. We're all too aware of the many complex health issues that women and girls face, as been described perfectly here today, and there does need to be a clear focus on women-specific issues as highlighted in today's motion. We saw headlines at the start of the month that outlined how over 37,000 women were on waiting lists for gynae services, with many waiting over 3 years for treatment. And just last week, we heard that breast cancer referral targets were being missed, with only 52.9% of urgent referrals being seen within the 14-day target. This means that during the quarter ending September 2023, 1,566 women were not seen within the target date. We need to do better for these women and girls. Early detection of breast cancer is key for targeted treatment and for increasing survival rates for women. And that is why we must also see the implementation of the cancer strategy, which will undoubtedly help to tackle these issues. As others have highlighted, there needs to be a strong focus on maternity services as we see increasing numbers of women accessing maternity services across the North. And this strategy must recognise the need to ensure the delivery of high-quality, safe services for women and families. And the progress on the mother and baby unit is also very welcome. The needs and health of women using maternity services are changing rapidly, and if improving women's overall health is at the heart of this strategy, this will ensure better outcomes for expectant mothers and their babies. Just a few months back, I myself had the pleasure of using the fantastic maternity services in Daisy Hill Hospital, and I cannot emphasise enough the first-class care that my baby son and I received, from my first scan to the aftercare I received in the community from the amazing midwives and health visitors. The wide-ranging and growing complexity of the care that maternity services provide cannot be understated, and we now have a real opportunity as part of this strategy to underpin improving the health and outcomes of mothers and babies, both prior to and during the time that they are being cared for by those working in maternity services, which will have lifelong benefits for women. As many of the speakers today have outlined, there is a clear and immediate need for the development of a women's health strategy. And it is important that as this work is progressed by the Minister and the Department, that the voices of women and girls are heard and listened to. Any plan or strategy brought forward must reflect those views and seek to address the disparities and inequalities they face across the health and care sector. While any plan or strategy will be primarily for the Department of Health, I do appreciate there may be some overlap with functions in other executive departments, and I would encourage other ministers and departments to work collaboratively with the Department for Health to address this important issue. In my role as the Income and Health Committee Chair, I want to ensure there is a clear focus on a women's health strategy. and the committee will work with and support the Minister in the Department where it can, and where needed will hold the Minister and Department to account on the key priorities that are brought forward. We will see where that balance is, but I trust it will be a beneficial working relationship. And I'd ask members right across this chamber to support this motion and amendment today.
Thank you, Liz. Can I call on Paula Bradshaw? And you have 10 minutes. Thank you.
Thank you, Deputy Speaker, and just wish you well in your new role. So I rise to support the motion and the amendment, and I am going to focus my remarks on long-term specialist support for endometriosis. But just before I get into my comments, I just would agree with all the speakers who have covered a wide range of issues today, and if I have time at the end, I'll cover a lot of those. So to look at endometriosis, I could start by focusing on figures and statistics, and they are indeed shocking. Endometriosis is a painful and exhausting condition which can lead to immense stress and discomfort. Yet not only do women, when they're diagnosed with endometriosis, I'll just call it endo, suffer from a lack of support and a lack of recognition, but it can take over a decade for the condition even to be diagnosed in the first place. Many women have told me that in some cases the entire journey from initial distress to surgery has taken nearly 20 years. As if the pain and exhaustion were not enough, there is the additional strain of uncertainty around diagnosis and lack of clarity about the likely options for treatment and support, and then the seemingly interminable wait for the appropriate intervention. We have already heard that comparatively far few women face this certainty, lack of clarity and wait in Northern Ireland than elsewhere in the UK. In fact, we're not even sure how many. When I asked an Assembly question during the last mandate about exactly how many women were waiting for diagnosis and treatment for endo, 3 trusts were not able to provide an answer. It is evident from the figures alone that it is long past time that those who are suffering such distress had the support they need. However, it is the human story which truly tells the tale. The story I've been told countless times is one of women seeking support and are not just being denied it or left to languish on a seemingly endless waiting list, but they are even made to feel like a burden. Female pain and exhaustion are too often overlooked in medical care everywhere, and when you add in our waiting lists and lack of specialist support, then the situation here is plainly even worse. I wish at this stage to pay tribute to the Northern Ireland Support Group for Endometriosis UK, without which many women would be in an even worse position than they are. Their work is invaluable. So turning, Deputy Speaker, to the contributions from today. So my colleague Nuala McAllister, she proposed the motion and called for it to be fully costed, fully developed in a holistic approach that's co-designed with representatives from across many sectors, and she also highlighted that it is Sexual Health Week. Linda Dillon raised the issue around the 2,000 women in 2022 who lost their lives to heart disease, calling it the leading cause of death for women, and she called for more timely and effective awareness raising among women. She spoke of her personal experience. Go ahead.
Member for giving way. It is actually the point I was going to make to the Minister around that awareness raising needs to be done in conjunction with the community. So given that Community Foundation NI is here, it is important that we support them in order to support the community to ensure that we reach those. There are not people who are hard to reach, there are services that are hard to access.
Thank you for fully endorse that. So Ms Dillon talked about her own experience of menopause, and she called for age-appropriate education in schools around menstrual issues to also include this area. So Diane Dodds, she talked about this debate providing an uncomfortable truth about the state of services and said that we need action on this issue. She talked about the link between deprivation and poor health, and went on to talk about the 17,000 women who've been affected by the cervical smear test review in her Southern Trust area, and talked about the questions. Yes, I will.
Would the member agree with me that despite the regrettable situation in the Southern Trust area, it should not put off any woman in Northern Ireland from seeking an appointment for screening?
Thank you. It's a very important point, and the All-Party Group on Cancer, the professionals who came from the Trust and from the Public Health Agency wanted us as elected reps to very much endorse that message. So thank you, Mr Chambers. So leaning on to your remarks, and I thank you for attending the Chamber. You were the first male to speak in the Chamber, and it's really important that this is not just seen as a women's issue, but that it's a whole of societal issue around getting women's health right. And you mentioned there around the long period of time in which women's health issues were disregarded, and that we have to adopt a whole life course approach to the women's health strategy. So turning then to my colleague Sinead McLaughlin, and she talked about the constituent she has engaged with who've had to leave work due to the debilitating pain from endo and the broken and inaccessible service at times for women. She talked about the long waiting times, painful waiting times for women accessing their first gynae appointment, consultant appointment, and she talked about her own diagnosis for endo. So Orlia Flynn talked about the APG on women's health, and I think that I would very much agree with the member that all the members on that from across this House have come together around these very important issues, and there is genuine cross-party consensus on the need for this women's health strategy. And I fully agree with her in that there are so many issues there that we need to ensure that this women's health strategy is robust and it is inclusive of all the issues across a women's health span. And we do need to catch up with our other parts of these islands. So Deborah Erskine, she talked about the amazing role of the community groups, many of whom are in this chamber this morning or looking on via our internet provision. And she said that we need to ensure that they are involved and that we build upon their work already, and that the actions that come from the action plan and the strategy are robust. She said that there needs to be wholesale buy-in from women, from the community groups and the healthcare professionals, and that training is really going to be essential for GPs. So my colleague Kelly Armstrong highlighted the fact that there are other parts of these islands, Scotland, England and Wales, that have already got their women's health strategies in place, and that we need to ensure that when we get ours developed, that it runs in time with budgets, and that it needs to be fully funded. She talked about, in particular, around the issue of menopause and how it is life-changing, with many women having to give up their jobs, reduce their income at a time when it should be the peak of their careers. She also talked about her own personal experience of miscarriage and trying to access fertility treatments. So Shan Mulholland, another colleague of mine, she provided in her maiden speech some insight into her constituency as the first mother to represent North Antrim, and in particular the barriers that the constituency she represents have in accessing healthcare in rural communities. She talked about how important perinatal mental health is, and again shared her own personal experience of perinatal and postnatal depression and anxiety, and I thank her sincerely for that. She also mentioned that the need for a specialist, for the specialist mother and baby unit to come forward, and for the Minister to provide the time frame for that. So Colin McGrath, also much indebted to you as another male, talked about again that the only region of these islands that doesn't have a women's health strategy, said that we have to remove the taboo and stigma around all the issues, highlighted the worst ovarian cancer survival rates, and that 90%. He also referenced his colleague Sinead McLaughlin's survey, where 90% of women indicated that they felt that services for women were inadequate. He called for a women's health ambassador and said that if we take this forward in building up hopes, we need to ensure delivery. The Health Minister thanked everyone for their personal contributions and said that the wider population of women will also have similar stories, and that he has placed this issue at, high on his list of priorities. He explained the process around the fact of bringing forward a women's health action plan in the first instance, and said that he felt that this was the right approach because it was demonstrated through the mental health action plan as a good way of getting the issues together and moving forward. And I think that another thing that I thought was of importance in the Minister's statement was around the issue of ethnicity, socio-economic groups and vulnerable and marginalised women, and the need to ensure that the strategy very much takes account of different groups of women in society, and talked about the opportunities for progress in the short term around the getting it right first time report around access to gynaecological services, and explained that he's looking at the recommendations around that. And Liz Kimmins then closed off by talking about health inequalities and gaps in healthcare and how we need to look at high areas of deprivation. Thank you.
Thank you very much indeed, Paul, and thank you very much indeed for keeping to the time. Thank you. The question is that the amendment standing in the names of Linda Dillon and Liz Kimmins be made. All those in favour say aye. Aye. Any contraries? Okay. The ayes have it. The ayes have it. Therefore, the question is that the motion as amended be agreed. All those in favour say aye. Aye. Any contraries? Motion is carried. Thank you. Right, that concludes the item of business, and members take their